Are you tired of having your sleep destroyed night after night because your bladder seems to have an alarm set for every 2 hours? Have you resigned yourself to thinking, well, I'm over 50, this is normal? Let me be direct with you. Waking up multiple times every single night to urinate is not an inevitable sentence of aging. I'm Michael Turner, urologist, and over the past 20 years I've treated thousands of men who believe they'd have to live the rest of their lives as prisoners of their own bladder. The truth I'm going to share today might shock you. In most cases, Nocturia, that medical name for waking at night to urinate, has very specific causes that can be identified and treated. And most importantly, there's a simple, science-based protocol that can give you back your full nights of sleep. Stay with me until the end, because I'm going to reveal not just the why this happens, but exactly what you can do starting today to reclaim your rest. Welcome. I thank you for being here and for caring enough about your quality of life to seek real answers. As a urologist, one of the most common complaints I hear isn't about pain, isn't about infections, it's about interrupted sleep. Men walk into my office with deep bags under their eyes, exhausted, frustrated, and tell me the same thing. Doctor, I can't take it anymore. I get up 3, 4, 5 times a night. My wife is tired. I'm a wreck during the day. And everyone tells me it's normal at my age. And that's where I stop them. Let me be absolutely clear. Getting up once per night to urinate after age 65 can be considered within normal range for some men. But getting up 2, 3, or more times, that is not normal. That is a sign that something is wrong and needs to be investigated. Nocturia isn't just an inconvenience. It's a silent thief that steals far more than your sleep. It steals your energy, your concentration, your patience, your safety, and even your relationships. Every time you get up in the dark, you risk tripping, falling, and seriously injuring yourself. Studies show that men with severe nocturia have an increased risk of hip fractures, and we know that a hip fracture after 70 can be devastating, but the impact goes beyond the physical. Chronic sleep deprivation caused by nocturia is linked to depression, anxiety, cognitive decline, and even increased cardiovascular risk. Your body needs deep, uninterrupted sleep to repair itself. When you're constantly yanked out of sleep, especially from the deepest phases, your body never completes its recovery cycle. So, no, it's definitely not just a problem of waking up to pee. It's a serious health issue that deserves serious attention. Let me tell you about Robert, 58 years old, married, sales manager. He came to my office, referred by his wife. Robert had been waking up 4 to 5 times a night for over 2 years. He told me, "Doctor, I go to bed with dread because I know that in 2 hours I'll be up again." My wife moved to the guest room because I wake her every time. During the day, I'm so tired I can't concentrate in meetings. I've almost crashed my car twice because I nodded off at the wheel. My life is falling apart. When I examined Robert and ran the necessary tests, we discovered he had a combination of 3 factors: a moderately enlarged prostate, he was taking a diuretic for high blood pressure at the wrong time, and he developed a habit of drinking lots of water at night out of fear of dehydration. It was a perfect storm. But here's the good part. Once we identified the causes, we created a plan. Within 6 weeks, Robert was only waking once per night. Within 3 months, some nights he slept straight through. His life changed completely, and yours can change too. Before we talk solutions, you need to understand the causes. Nocturia isn't a disease itself, it's a symptom. And to treat it effectively, we need to identify what's causing it. I'm going to explain the 5 main causes I see every single day. Cause number 1, benign prostatic enlargement, BPH. This is by far the most common cause in men over 50. The prostate is a walnut-sized gland that sits right below the bladder and wraps around the urethra, the tube through which urine exits. With age, due to hormonal changes, especially increased DHT, a testosterone derivative, the prostate begins to grow. This is called benign prostatic hyperplasia, or BPH. It's not cancer, but it causes problems. As the prostate enlarges, it squeezes the urethra like a garden hose being stepped on. This makes it harder for urine to flow. But here's what many people don't understand. The bigger problem isn't during the day when you're upright and active. The problem is at night. During the day, you go to the bathroom regularly, and your bladder rarely gets completely full. But at night, while you sleep, urine accumulates. With the urethra partially blocked, your bladder has to work harder to empty. Over time, the bladder muscle gets irritated, hyperactive. It starts sending "I'm full" signals even when it's not. This is called overactive bladder. It's a vicious cycle. Enlarged prostate leads to incomplete emptying, which leads to irritated bladder, which leads to more urgency. Cause number 2, the medications you're taking. This is a cause many doctors forget to investigate properly. Several common medications worsen nocturia. Diuretics, the water pills for high blood pressure or heart failure, are the most obvious. If you take a diuretic at 6 or 7 p.m., of course you're going to wake up all night. But there are other culprits. Some antidepressants, antihistamines for allergies, and even certain diabetes medications can affect bladder function or increase urine production. The problem is that rarely does anyone connect the dots. You start a new medication, and a few weeks later, your nocturia worsens. But you don't even notice the connection. Cause number 3, wrong timing of fluids. This is the mistake that probably 90% of my patients make. They've heard they should drink 8 glasses of water a day, so they drink, but with no strategy whatsoever. Many drink little during the day because they're busy, and then compensate at night, or worse, they drink a large glass of water right before bed because someone said it's healthy. I'll be direct. If you drink fluids in the 2 to 3 hours before bed, especially large amounts, you will wake up. It's not a question of age or prostate, it's pure physics. The fluid that goes in needs to come out. Cause number 4, undiagnosed underlying medical conditions. Uncontrolled or undiagnosed diabetes is a major cause. When blood sugar is high, the kidneys work overtime trying to eliminate excess glucose, producing more urine. If you're waking multiple times and also feeling very thirsty, unexplained weight loss, or blurry vision, you need to check your glucose urgently. Sleep apnea is another. When you repeatedly stop breathing during the night, your body releases hormones that increase urine production. Many men with severe nocturia discover they have untreated sleep apnea. Mild heart failure can also cause it. During the day, fluid accumulates in the legs. At night, when you lie down, this fluid returns to circulation and the kidneys filter it, filling your bladder. Cause number 5, bad nighttime habits. Caffeine and alcohol at night are enemies of your sleep. Both are diuretics and bladder irritants. That after-dinner coffee or that beer while watching TV might seem harmless, but they're sabotaging your night. Also, sleeping in a room that's too cold can make your bladder contract more and increase urgency. Now that you know the causes, let's get to the practical solutions. This is the 6-step night protocol I use with my patients. It's not magic, it's science applied with consistency. Step 1, golden rule of fluids. Drink most of your fluids before 6 p.m. Your goal should be to drink plenty of water during the day, especially in the morning and early afternoon. But after 6 p.m., drastically reduce. Only small sips, if necessary. And nothing, absolutely nothing, in the hour before bed, except maybe rinsing your mouth. If you take a diuretic, talk to your doctor about taking it in the morning, never afternoon or evening. Step 2, the double voiding ritual. 30 minutes before you go to bed, go to the bathroom, urinate, wait a few minutes doing something else, and then try to urinate again. This is called double voiding. You'll be completely emptying your bladder, including any residual urine that gets trapped due to prostate obstruction. Then, right before lying down, go one more time. You might think nothing comes out, but try. This establishes the habit. Step 3, elevate your legs before bed. If you have leg swelling during the day, that fluid is going to return to your circulation at night. 2 hours before bed, lie down on the couch and elevate your legs above heart level for 20 to 30 minutes. This forces the fluid to return earlier so you can urinate before bed, not during the night. Step 4. Cut evening irritants. No caffeine after 2 p.m. This includes coffee, black tea, sodas, chocolate, no alcohol after 7 p.m. If you need to drink something warm at night, chamomile tea or lemon balm are good options. And reduce salt at dinner, because salt makes you retain fluid and feel thirstier. Step 5. Train your bladder during the day. Many men with nocturia develop the habit of going to the bathroom just in case whenever they see one. This trains your bladder to send urgency signals at smaller volumes. During the day, practice holding a little longer when you feel the urge. I'm not talking about holding until it hurts, but waiting another 5 or 10 minutes. Gradually, you retrain your bladder to hold larger volumes. This is called bladder training. Step 6. Consider natural supplements with medical approval. Saw palmetto, beta-sitosterol, and Pygium africanum are supplements that have modest evidence of helping with enlarged prostate symptoms. They're not miraculous, but in mild cases, they can make a difference. Always discuss with your doctor before starting. Now, let's talk about when you need to see a urologist immediately. Don't try to solve it yourself if you have any of these warning signs. Blood in urine, even if it appears only once. Pain or burning when urinating. Very weak stream or difficulty starting to urinate. Feeling of not being able to empty completely. Waking 5 or more times per night despite following the protocol. Unexplained weight loss. Any of these can indicate something more serious like infection, stones, or even prostate or bladder cancer. Don't ignore it. Back to Robert, my patient. After identifying his causes, we did the following. We switched his diuretic to take at 9 a.m., implemented the golden rule of fluids, started saw palmetto, and bladder retraining. Within 6 weeks, he was already much better. But most important was the mindset shift. Robert realized he had control. It wasn't just getting old. It was choices, habits, and treatable causes. To conclude, I want you to understand one fundamental thing. You don't have to accept waking up all night as your new normal. Nocturia is treatable in the vast majority of cases. Sometimes the solution is as simple as changing the time of a medication. Sometimes it requires more specific treatment for the prostate. But almost always, something can be done. If this video opened your eyes to possibilities you didn't know about, do 3 things. First, subscribe to this channel. I'll continue bringing practical information about men's health that your doctor may not have time to explain. Second, share this video with other men you know who are suffering in silence. Third, take action today. Start the protocol tonight. Write down when and how much you drink. Observe the patterns, and if necessary, schedule an appointment with a urologist. Your nights of full sleep are waiting for you. You just need to take the first step. I'm Dr. Turner, and my mission is for you to live with health, energy, and dignity at every stage of life. Take care of your prostate, take care of your sleep, take care of yourself. Until the next video.